Mimi, we're making this a habit today. Looks like we've got quite a few people coming in here. This is great. Welcome, welcome. Thank you for being here. So it's Friday, September 11th. We will speak more about September 11th in a little bit. Thank you all for joining. I'm Valerie Rochon, President and Chief Collaborator for the Chamber Collaborative of Greater Portsmouth. For those of you whom I haven't met, I'm sorry that we haven't met, because I'd like to meet more people now, in person even. And also with us are Ben Van Camp, our VP of What's Next, and Jen Stevens, who's our communications guru. And they are always here in support of this chat, so we appreciate that. And thank you for being here. As usual, a little bit of housekeeping. We're going to keep you on mute. So if you have any questions, please enter them in the chat function. We're all pretty good at doing that nowadays. So make sure that you put all your questions in there. Ben will be watching those and monitoring them. And when we get to the Q&A session, Ben will help you to ask those questions. If we do get hijacked, which thankfully it hasn't happened yet, but sometimes they do on Zoom calls. And so if we do, Ben will shut this down immediately and we'll try to reschedule, even though I know Patricia has an incredibly busy schedule, but we'll try to bring her back here. And all Chamber Chat Live events are recorded and they'll be posted to our Facebook and our YouTube and on our website. And you can see all past recordings of Chamber Chat Lives at portsmouthcollaborative.org. And if you look at in the drop down, I think it's Chamber Events. Ben's going to correct me there. That you can see them all. So I think it's under new events or something like that. So today we have Patricia Tilley with us, and she's the Deputy Director of the New Hampshire Division of Public Health Services. And she has some incredibly important information for all of us who run businesses or work in businesses or have a family or who actually come in contact with people. So we'll hear from her in a few minutes. But first, I have a little bit of chamber news that I want to share with you. So first of all, we have two very exciting chamber events coming up. The first is we have an annual dinner and awards event, which is usually outside in a unique location around Portsmouth. We call it Street Life. And as many of you know who've come to many of those, if you want to know what the hottest day of the year is going to be, just listen for when we're going to have our Street Life event, because it always is. And we have it in unique locations around town. We have a ball, and it's all about networking and celebrating those that have won their awards. This year, for obvious reasons, we've, what do I want to use? Pivot, reimagined, rejiggered in these challenging times, all of those words that we're so tired of hearing. But it's called Stream Life this year. Pretty creative. And we'll be using the virtual platform Remo, which has a little bit more flexibility. It'll be a lot more fun than Zoom, a little bit of a different platform for us. We're going to announce the winners of our annual awards: large business, small but mighty business, volunteer, collaborator. And this year we have a very special award, Pandemic Powerhouse. So you're going to want to know who those people are so you can celebrate them. You know them all. Many of you know them. It's September 24th from 5 to 6:30. You can get your tickets now at portsmouthcollaborative.org and go to the events calendar. There's a couple of different options for you. If you're a member of the chamber, it's only $25. If you're a non-member, it's $35. And if you want our very special gift basket to be delivered to you, usually we have a dinner. This time we're doing a gift basket. There might be something to, a beverage and a food item in there. And that's an additional $50, so like a $75 value. So $50 gift basket that will be delivered to you. So join us for that. That's going to be fun. We've got a lot of surprises and some fun happening there. And we also have the 37th Annual Chamber Classic Golf Tournament and the first ever Fancy Pants Contest. And I think that's a Jen thing. Jen is our not only communications guru, but also our events coordinator. And that definitely sounds like a Jen saying to me. Do you want to share anything there, Jen?
No, I just see that we also have some people from some of our sponsors online, so that's good as well. We are very much. Hi, Kevin from Invest Financial. But I don't want to miss anybody else, so I just did something very wrong. If there's anyone else, just ping me. But yeah, we're looking forward to it. Thank you, Valerie.
Yes, fancy pants. Can't wait to see that. And we did have a little discussion about that for women, right? So
you can wear a skirt. You can wear a skirt, but you will not be eligible to win. Sorry. Women can wear pants too.
Okay.
And men can wear skirts, but they can't win if they wear a skirt.
Thank you for the rules, Jen. That's great. So that's on October 9th. And again, you can find that on portsmouthcollaborative.org. Go to our chamber events. If you're not already following us on Facebook, Instagram, and Twitter, you're missing out on a lot of great stuff that Jen shares. So find us at Portsmouth Collaborative and go Portsmouth NH. Quick updates on the task force, the Citizens Response Task Force. The Public Realm Committee is switching to what are we going to do for the fall and the winter. So we've managed to source some outdoor patio heaters that have been approved by the fire department. I'm going to order those. We've negotiated a bulk rate, which is significantly cheaper than what you would pay if you just went to the Home Depot or Lowe's or whatever. So I'm going to order those on Tuesday. If you didn't get my email that gives you all that information, my email is valerie@portsmouthcollaborative.org. So email to me and I will send that to you so you can, if you need some outdoor patio heaters to extend your season, then email me so I can give you that information. I'm going to order those on Tuesday. The more we order, the cheaper it gets. So think about that. And we are hoping the Citizens Task Force made a recommendation that we're going to ask on Monday night that the City Council extend the outdoor dining. Right now it needs to end on October 18th, but we've asked for it to be extended until October 31st. We are cautiously optimistic that they will approve that. We heard nothing negative. There was nobody that really wanted that to end right away. So till the end of October is great. We're going to try to do that. The Bridge Street lot is also going to try to stay open until October 31st. They have a lot of sold out events and they've added the retail component. So I believe the Seacoast rep, anybody can correct me here, the Seacoast rep I think has their last cabaret this weekend and they are almost sold out. So make sure you get to visit, go to popupnh.org to get that schedule so that you can get your tickets. And the health subcommittee is working on FAQ sheets for different things. One of them is air filtration systems. So a lot of you have asked about air filtration and what's the best thing for the size of your space. The health subcommittee is not going to give you recommendations. They are going to identify some of the air filtration system possibilities and put those in the FAQs. So take a look at those. It's going to be up on the website, cityofportsmouth.com. And I just usually search for Citizens Response, but Stephanie, if you have a different answer for where to go specifically for that information, so Stephanie Secord sits on all the committees on the task force. So Stephanie, if you want to put that in the chat function for us, that'd be great if I hadn't said that correctly. So they've been doing an awful lot of work on health, and they're also going to be talking Monday night at the City Council meeting about the mask mandate, which as a chamber we are completely supporting, mainly because most people are doing it. Most people are wearing masks and they're being very respectful. But I think we need a mandate for those that are not wearing masks and are not being respectful, and our frontline staff is getting bullied at times, and I know people don't necessarily know that, but they are, and that's not okay. So we really like to have a mask mandate. So we'll be speaking in support of that on Monday night. If you would like to speak on Monday night at the City Council, you can do two things. You can go to cityofportsmouth.com and you can submit your position on anything. It goes right to the city councilors. or you can sign up to speak on Monday night during the city council meeting. So support that, those masks. And please also remember to upload your open positions to our jobs board on portsmouthcollaborative.org. So reminder once again that we're going to hold off on questions until Patricia has finished speaking. And so enter your questions during chat. And you're going to remain on mute unless you wave like crazy and Ben thinks that he should let you unmute you. So our guest today, I have seen Patricia speak before, and you're going to be blown away by the amount of information you're going to get here. Patricia Tilley is the Deputy Director of the Division of Public Health Services within the New Hampshire Department of Health and Human Services. She has spent more than 20 years working on behalf of Granite Staters to reduce health inequities across the lifespan with the goal of preventing premature death, disease, and disability from environmental causes. Most recently, she's been the public health contributor to the governor's COVID-19 reopening task force, and we all know how much work that was since April. Patricia, they've been working so hard on that, creating all that guidance for all of us that we are living by now. Patricia, thank you so much for joining us.
Absolutely. Thank you so much for having me. Thank you for inviting me. So I'll ask Ben to throw my slides up on the screen when he gets a moment here. Today, so first of all, again, good afternoon. Thank you for having me. I'm going to be talking a little bit about testing, about contact tracing, your responsibility as a business if someone or your staff gets COVID and tests positive. I think many of you who are on the main streets of the Seacoast know that health and good public health practice really is the foundation of thriving communities. This was true before COVID, and it's especially critical today. So again, thank you for inviting me to have this conversation with you. Please use that chat function and ask questions, and we'll try and get those addressed as we move forward. So if we can switch to the next slide, we're going to dive right into the numbers. So I hope all of you have taken a chance to look at our interactive dashboards that are on the New Hampshire .gov/COVID-19 website. We have a couple of dashboards available. You can flip back to the previous slide. We have a couple of dashboards available to everyone. This is the summary page of the interactive dashboard. You can see today that we announced 56 cases yesterday. The numbers are continuing to go in the wrong direction. You can see that on the trend line right there. Excuse me, I have a phone call coming in. I need to turn that off. So you see that we were really good after we put in our safer at home guidance. Numbers started to decrease and we had a little bit of bump. They went down again around July and August. And really, quite honestly, not surprisingly, as school is starting to come into session, we're seeing those numbers continue to go up. The good news in all of this is we have less than 10 people in the hospital right now. We have been able to test everyone who wants a test in the state of New Hampshire. Our death rates continue to be fairly low and really concentrated in that population of those who are over 80 years old and oftentimes in long-term care, although not always in long-term care. So that's a little snapshot of where we are today. There's 272 active cases around the state. I hope you all get a chance to pop in on these interactive dashboards. You can all be an armchair epidemiologist and run all sorts of filters and figure out the numbers in different way. It's a great way to spend an hour or two, or at least I think it's a great way to spend some time. So we can flip to the next slide right now. So as we noticed, as we talked about, I've been on the governor's reopening task force back since April. The governor has been an incredible support to small businesses. And I think the good news is that we have been working with businesses since the very beginning of the pandemic. We have only seen a relatively small number of outbreaks in workplaces, other than places like long-term care facilities and other congregate residential settings. Businesses across the state have followed these guidance documents to keep their staff and their customers safe. So for that, I also want to thank all of you who are on the call today, because we know that it's hard and we know that it's been expensive, and we know that it has really changed the policies and the processes of much of your work. So thank you for being willing to adapt that way. We can switch to the next slide now. So one of the things that we wanted to talk about today was contact tracing. So contact tracing is a tried and true public health measure, and it has been successfully used to contain communicable disease forever. So things such as HIV, sexually transmitted infections, tuberculosis. This is the bread and butter of much of the work that our public health staff have been doing forever, and really happens in the background. So most of us never really come in contact with that, thankfully. COVID has changed all of that. And I think all of us are a little bit more interested in how this process works. And so there are 4 main strategies to keep transmission rates low in any communicable disease, but especially for COVID-19. And that is testing, isolation, contact investigation, and quarantine. And the whole idea is, as this used in this this figure came from folks that had been at the CDC that are no longer there, Thomas Friedan and others, that are really focused on this box it in communication strategy around testing, isolation, contact investigation, and quarantine. We can switch to the next slide right now. So just for a little second, here are some basic definitions. And this document that is up on the screen right now can also be found on the COVID-19 website. We have an enormous amount of resources, and this document is there. But I think it's really important to start with definitions. And because we are all using these words right now in a way that we've never before done. So, how many times have we said the word quarantine recently? It's just top of mind for everybody. But what we find is that some folks don't always know the nuances between each of those categories, and they're not interchangeable. So just so that we're all on the same page today, isolation is for people who have symptoms. Quarantine is for people who have been in close contact with someone with COVID-19, or in the case of New Hampshire, that you've traveled outside of New England. And quarantine is for people who don't have symptoms yet or ever. And finally, self-observation is what we should all be doing every day. That's what we're asking your employees to do. That's what we're all doing, of monitoring your health symptoms, taking your temperature, and just generally checking in on how you're doing. So I think the other thing that's important for this little document, and again, we can send these slides out to you when we're done if you would like them, is to really, there are a number of questions there, is to really understand what it means in each of those. So if you're in isolation, there are a certain set of things you can and cannot do. If you are in quarantine, there are certain things that you can and cannot do. And so I think it's helpful to use this document as a refresher so that we are all on the same page when we're using this language. We can switch to the next slide right now. So the next thing, as I talked about, sort of that box-in strategy, the first part of that is testing widely. Since the beginning of the pandemic, more than 360,000 PCR tests for New Hampshire residents have been analyzed at both public and commercial laboratories, including 25,000 tests in just the past 7 days. If a New Hampshire resident wants or needs a test, they can get it. And currently, our turnaround is often less than 2 days to get your results. This is a vast improvement than where we were earlier this summer, and there was lots of media accounts. And as the southern parts of the country and the western parts of the country had some spikes, we were having some difficulties with some of our commercial laboratories like Quest or LabCorp, and it was taking almost up to 2 weeks for some of those test results to come back. And that was really unacceptable for all of us. It's unacceptable from a public health perspective, and it's certainly unacceptable for the public who have had a test and really need to know what the next step is. And they really need to get that test turned around. So we're much happier right now that we're seeing this much quicker turnaround for PCR tests. And PCR tests are the gold standard right now. And those are the ones with the swab that goes like way up your nose, feels like it's tickling your brain. It's not generally pleasant, but it is quick. And the good point about that is it's also the gold standard. We can feel confident in those test results. Those swabs, they go back, they get put in a little tube with some media, they get sent out to the laboratory, and you get your answers back, hopefully within about 48 hours. And we really want the public to know that they can feel good about those tests. So we can switch to the next slide now. So the next part that we're going to talk about a little bit is contact tracing. So contact tracing is really the strategy that's needed to isolate, find, and quarantine folks. New Hampshire has been able to do contact tracing on all of the more than 7,000 cases in our state. It does this through three main activities: through case investigation, contact tracing itself, and health monitoring. Again, as I noted, all of the test results, you put the swab up your nose, you get a result, all test results are sent to public health. That is in legislation. That is part of our job in public health, is to manage those communicable diseases. Once we receive a positive result, we begin investigation with the individual who tested positive. We make sure that you're connected with your healthcare provider, and we begin asking questions about your health of the person who was tested positive and their supports at home, who can help them as we start going down this journey of either isolation or quarantine. And we also ask about who your close contacts are, including questions about the place of employment for an individual. The document that I've screenshotted here is our case investigation and contact tracing plan. That is available online as well. You can Google it. You can find it on our COVID-19 website. If you want to go way deep into the nitty-gritty details, we have tried to be as transparent as possible every step of the way as we together try and work on tackling COVID-19. We can switch to the next slide now. So I know that there's been some anticipation. This is a handy little graphic that is within that contact tracing plan. And I think it's incredibly helpful. So you sort of have a sense as an employer, as a business, what's going to happen next, or even as an individual, what happens next after I test positive. As part of contact tracing, it's important to know that public health will contact employers if, through the initial investigation, it becomes clear that the individual who tested positive was in close contact with other employees. Close contact is being within 6 feet, it's not exactly 6 feet, but you get the sense, 6 feet of another person for more than 10 minutes, and that is cumulative. So if you think about, again, this 6 feet, we've all heard social distancing for the past almost 6 months now. We've ingrained that in our head. That's the social distancing. And it is really a matter of the distance plus time. And so, I think as we work through some of those guidance documents, for example, in retail, I use the market basket example. Those cashiers that are on the front lines doing essential services, wearing their masks, behind the plexiglass, they're doing great work. The good news is that typically they're not in contact with individuals within that 6 feet for more than 10 minutes, other than their coworkers, but certainly the public. And that's great. And so that we move those folks through. We have other places where, we think about employees that are in, say, manufacturing or other environments where you may not have public circling in and out, but you're in close contact with someone for a very long time. And we certainly saw that nationally. It is where we saw massive outbreaks, not in New Hampshire, but in other states around things like food processing plants and other manufacturing, where people were standing very close next to each other for 8 hours a day. That really increases the chance for COVID transmission, and it also creates close contacts. Our team will call employers, again, if someone on your staff tests positive. We'll also help and ask you to rope in if you have occupational health safety programs. Some of your larger organizations may have that. But we also know that a lot of folks are just sort of mom and pop Main Street organizations, that you don't have a safety officer, you don't have an occupational health department. So we're going to be really working closely with whoever is designated as the liaison with the Division of Public Health Services. It's important to also know that DPHS may legally share information with employers regarding an employee's COVID-19 or exposure status in order to carry out our public health activities, including excluding a person from work. We ask that the employer, and we don't really ask, it is a requirement, the employer is required to protect the employee's health information, both under New Hampshire law and the American with Disabilities Act. So this is, again, a tricky line that we sometimes have to traverse. When we're doing contact tracing, we do not share the individual who was the index patient or the person who was sick. We don't share that name with the people they've identified as close contacts. So, if I test positive and I give the public health nurses my list of close contacts, when they call up that list of people, they're not going to say that Patricia Tilley was the person who tested positive. They're only going to say to that person is, you've been identified as being in close contact with someone with positive COVID-19. And so we ask employers to do the same. And in fact, you are required by law to do the same, is to protect the health information of that individual. Now, we know that individuals sometimes choose to self-disclose, and that's all fine and good, but it is our responsibility, both within the state and within the employer's responsibility, to hold that name and make sure that we're not sharing health information inappropriately. Our public health business liaison unit will work with employers, again, to obtain employee lists and lists of contractors who could also feasibly expose. Say, for example, if you have contracted housekeeping or a contracted cafeteria, we're going to want to know all of those names. If a business is a regulated entity, like a food establishment or childcare, our public health team will also engage our licensing colleagues to work with us. This is a place that there's been a lot of questions around, especially in the food establishment world and somewhat in childcare as well. Our regulating, we have some different roles in the Department of Health and Human Services, and one of them is a regulating role. And so, we work with small towns. Now, in the city of Portsmouth, you regulate your own food establishments. So we work closely with our cities and our municipalities there. But in small towns, the state of New Hampshire actually does all of those health inspections for food establishments. And so we try and bring people in together to help work together to help the employers get the information that they need. But there's a line in between the guidance documents that were created for Safer at Home for COVID-19 and the administrative rules of regulated entities. So that's something that I know that we've often had conversations about with people of sort of whose rule is what. So in the city of Portsmouth, your folks that are coming out of the city will focus on the administrative rules that are set for food. And there are other folks that are really interested in the enforcement side of those guidance documents from Safer at Home. So there's a little bit of a confusion among some folks there, but I think the real point to remember is that everybody is on the same page of just trying to make sure that we have safe environments for workers and for the public. I think that let me think about if there's anything else on that document right there that you might have questions. Feel free to throw it in the chat. And it's a little fuzzy, so I apologize for that. But again, as we walk through this process, our disease investigators can do the case investigation. They're going to assign, if it appears that this person is working somewhere, we're going to assign that to our business liaison unit. They're going to get in contact with you, especially if we start seeing something that might be looking like a cluster. We're going to work with their businesses to get those lists of names of close contacts, who was on the same shift as that person, were they close to each other? And we're finally going to work really closely with you as well around communication. There are relatively few times that the Department of the Division of Public Health Services is going to require that there's public notification if there is a positive case of COVID-19 in your workspace. So reasons why we might make a public notification are when we can't identify everyone who was in those 6 feet of that person for more than 10 minutes. And so we have done that with a couple of restaurants over the past couple of months, but very few, quite honestly. Or if there are large events. So the large events that I think about right now are things like the Sturgis Motorcycle Rally in South Dakota. You know, we have no idea who went there. We do know that we've had a number of cases in New Hampshire of people who went to Sturgis and came back to New Hampshire and tested positive. And so we do a public notice and say, if you went to Sturgis, you should probably get tested. As I've noted, there's a couple of other places where we've done it where we just don't know who was there. Now, on the other hand, businesses can be very transparent themselves, and many of them have that commitment to their communities. And so they choose on their own to say, you know what, we're closing down for 2 days because we've had a positive case of COVID, and here's what we're doing to protect you and our staff members. And that's fine, and we are happy to help you and work with you on what that communication can look like. But often cases, it's not a requirement of the Division of Public Health Services to do that level of notification. So again, if there are questions about that, I'm happy to answer that later. If we switch to the next slide right now, I would suggest that if you haven't, or if it's been a while, that you review the state's universal guidelines that came out of the governor's reopening task force. They were developed with the folks on the task force, industry feedback, a lot of industry feedback, public health guidance. You know, Dr. Ben Chan, we've all seen him. He's like a movie star these days, but he went through and he reviewed all of those guidance documents. And we've also had a lot of assistance from the Attorney General's office in terms of its enforceability. The guidelines apply to all businesses and not only talk about preventive measures that, you know, everyone should be taking. It also provides definitions and more detailed information about the policies you should be developing, you know, in preparation. We continue to learn more about the risks as the data comes in from around the country. You know, we've had CDC has been publishing great resources. You know, there was one about a hairstylist. You know, beauty salons and hairstylists were among some of the first things that we opened in New Hampshire, and we had a lot of public feedback. And public feedback on both sides, where how, you know, we desperately need to open it, we need to open right now, all the way to how can we put our staff and our clients on the front edge of COVID, and everything in between. We had gotten some information from CDC that I think was really positive, which basically said they had a case in Missouri where there were 2 hairstylists, both who tested positive in and had been practicing and doing their work in their salons. But they had followed their guidance of their county health department, and everyone had worn masks. There was tons of the cleaning, the same sort of recommendations that you see in our guidance. And of the 136 or 139 clients that those 2 folks who tested positive had seen during their time, not one of their clients tested positive. And again, the thought behind that is really because all of the guidance was being followed and being followed to a T. We've seen opposite cases as well from CDC. One, you know, really that got a lot of media attention was around camps. There was an overnight camp in Georgia that essentially didn't follow any of the recommendations, and over 200 of their children and staff ended up being sick at the end of the day. So I think that this is, again, the thing that's held New Hampshire on a pretty good path all along is really been the cooperation of our business community. You know, we also may hear in the media today, CDC again has just released more findings from another case control investigation of symptomatic patients from 11 U.S. healthcare facilities, not New Hampshire. New Hampshire didn't participate in this, but they found that the close contacts with persons with known COVID-19 or going to locations that offer on-site eating and drinking were associated with COVID-19 positivity. So again, it wasn't that there was necessarily a cluster in those on-site food establishments, but that people who had tested positive in these different sites across the country said, and in talking about where they had been, many of them had been to on-site eating establishments. But what was also noted in this remark, in this study, is that the more guidance and more protective measures that were put in place by those establishments, the less likely we were to see positive cases. So we can switch to the next slide. So that being said, I additionally strongly encourage all businesses, if we can switch to the next slide, to check out the BEA website. Commissioner Caswell and his team have been amazing at supporting businesses in their community. And they've gone through and answered more than 8,000 emails with questions from individual businesses, 8,000 emails. That's a whole lot of people's jobs right now. And they've developed a new set of FAQs that answer some of the more common questions they've received. So again, I encourage you to go ahead, take a look at that, go online and take a peek. And typically the FAQs really serve to, clarify portions of the universal guidance and share some resources that help businesses throughout there. So please take a look at that. And then I think we can switch on to the next slide and I can wrap up and take any questions from you all. Here are just a couple of resources for you. So if you've got individual questions about your businesses, I strongly recommend putting your email in the queue of those 8,000 other emails. They're being answered. I know I get bumped emails. They're really good at sending them to the folks that need to answer. So go ahead and use that email for your contacts from BEA. And then the other place where you can really get some good questions answered is through public health and through our public health team. 211 is still up and running right now. So if you have general questions like where can I go to get a test? Where can I, how do I understand what my test results are? Or I'm a business and I just need some questions answered. You can go through 211 and that will get bumped to the right resource along the way. Or you can call our public health nurses directly at that number, which is the 271-4496. And that's really great if you have a question about the policies that you're creating, or if you find out oftentimes, you've got great employees that will let you know, like, I'm feeling symptomatic, what should I do? You can always go to the resources that are available through the universal guidance, but you can also always feel free to call one of our nurses on this line and they'll get back to you and help you walk through exactly what to do. Because even though I've just spent some time right now just rattling off a bunch of stuff, I'm sure when the day comes when either you test positive or someone in your family tests positive or, an employee tests positive, I'm sure your mind's going to go blank and you're just going to want to be able to talk to someone. And that's what we're there for here at the team of public health. So again, I want to thank you for inviting me today. Please always stay informed with our COVID-19 website. Tons of data available for you there. Tons of resources, tons of links to other things, whether they are in CDC or OSHA or other folks. I really encourage you to take a peek at the school interactive dashboard. I know there's a lot of questions about that right now, about the impact of schools. We have the ability that you can filter and you can look at all schools that have an active case. You can see them all. You can filter it by town. You can filter it in a number of different ways so that you can get the information that you need. So I'll wrap up right now. I'd be happy to answer any questions. So thank you very much.
We did have a couple questions come in. You mentioned the PCR test being the gold standard. Are those readily available at local pharmacies, or do you have to go through your PCP?
So that's a great question. So you can certainly go through your PCP. And I always recommend that, especially if you're having symptoms, that you call your PCPs because they're going to walk you through that. One of the slides I didn't put on right now that I've been using a lot is the overlap between seasonal allergies and COVID symptoms. I mean, my voice is a little raspy right now from the ragweed. So it's always a great idea to call your PCP. The PCR tests are also available at some of our retail pharmacies. We have a couple of other community-based sites that are opened up. So again, if you go to our COVID-19 website, you will see a little button that says testing. It'll take you right to it, and it'll give you a map of everywhere you can get tested. We also encourage you to use Clear Choice or Convenient MD. They're also providing those PCR tests.
Great. Another question, which I think I'm understanding, is about the contact tracing, and I know from friends' experience that it may take a couple days for that to start. What is the timing on that? And if you're in that chain, how quickly will you be notified if your hairdresser had contracted it or something along those lines?
Yeah, so it can depend. So one of the things I will suggest to everybody is to answer your phone. I think we're all accustomed these days. Like, I see a phone number, I don't know it, I am not answering it. I just got two while I was on this presentation, and so you just pass by. This is the time to actually answer your phone because that really impacts the amount of time it takes to be contacted. So we will reach out both to the, I'll call it the index person, the person who tested positive. We're going to get that contact list from them of their close contacts. If it's appropriate, we're going to reach out to the employer. We're going to get that list. And so it's going to happen over the course of days. We are working at Public Health right now 7 days a week. We are doing contact tracing 7 days a week. We have staff working from 8 a.m. to 8 p.m. every day. So you may also get calls. Don't be surprised if you get a call at 7 p.m. at night because our staff is working. We've got shifts of staff working, covering at least 12 hours and quite honestly later than that every day to try and get a hold of people. So it may take a couple of days, and it really is dependent on the, how quickly people pick up their phones.
Sorry, I'm trying to read and talk at the same time. Could you clarify the recommendation about travel outside New England states? Does a negative COVID-19 test during the 14-day quarantine shorten the amount of time that an employee should quarantine?
This is probably one of the number one questions that we get, and the short answer is no. So again, if you have an employee that travels outside of New England, and this is a requirement that's built into our universal guidance, so it's fairly enforceable. It's in there. We ask that they quarantine for 14 days when they come back. They can work at home. It doesn't mean they can't work, but they just can't come into the business at that point. We do not allow folks to test out of quarantine from travel-related illness because if you think about it, it counts from the last day you were somewhere. So on the day you flew back from wherever it is that you were coming from, or the day you drove from wherever you're coming from, you could have been exposed on that day. And it can take up to 14 days to either show symptoms or for that test to show positive. Now, I will say what people get confused about, it is possible to essentially test out of quarantine or isolation. You can test out of isolation if you have symptoms. So again, you have an employee comes to work and they're coughing, they're hacking, and their nose is runny, and this is a new or unexplained symptom. If they go and get tested because they were symptomatic, they go and get tested and get a negative test, they can come back because we can confirm that those symptoms were in fact not COVID-19. So you can test out if you have symptoms. You can't test out for travel.
Great. Someone was curious if someone in the contact tracing chain never answers their phone. Do you take it to another step? Do you knock on their door? How does that work?
So sometimes we do. It really depends on the level of risk. We have, Public Health has some legal authorities, so we can also go out and if we know that someone tested positive and they're not answering the phone from us in particular, or they're sort of evading talking to us, we can do something called, or we can put execute orders, which is essentially we can go to them and we can order them to quarantine or to isolate. And so usually that enables us to start the conversation about contact tracing. We do that very rarely. Really, most people are very cooperative, but if we have someone who is being uncooperative, we have the authority to go out, we track them down, we knock on the door, and we can serve them with legal orders for quarantine. And then usually that starts a conversation. What we found mostly is when we come up against that sort of resistance, it's usually a lack of education. Folks are scared. Folks are don't really understand what's happening. You know, early on they're like, I feel fine. Why are you bothering me? Like, I've got no symptoms. And I think as the months have gone by, we all understand at an even deeper level right now that even those asymptomatic people can transmit the disease. So we find that once we can really get in touch with people and have that sort of conversation, that things start to open up. But we do have the authority to track folks down, knock on the door, serve orders.
Very interesting, I guess. There's a lot of good questions coming in, so this is great. So Jonathan, our friend from White Heron, which I wish that was what's in this cup right now, but it's not. Just water. It's not that time of the afternoon yet. So they want to know if their staff member, say they had a significant other, somebody they lived with, travel outside New England, when they return, should they also quarantine, or is it just the traveler?
It's just the traveler. You know, and that's even the case also if you are, we will talk with folks, there's some question like, I'll use my own personal example. My daughter, college senior, she was at a summer program this summer, and someone in her unit tested positive. And so she had to come home and quarantine. I did not have to quarantine. So she did, she got tested. She was quarantining for 14 days. She came back negative, thankfully. But I, as sort of the close contact of a close contact, didn't have to quarantine. Now, I chose to do that out of an abundance of caution, but I also have the capacity to work remotely. The other issue that we come in contact with right now is the idea of essential workers or workers that are in critical infrastructure services. And so sometimes we work with businesses in that area. I'll use the example of something like Seabrook. If there are only 2 people in the state who can run the control room at Seabrook, we're going to have some try and have some more accommodating conversations in that scenario. But it is also the reason why places that have that sort of critical infrastructure really do an incredible job of keeping their staff safe along the way.
Great. Another question came in about basically asking if there's anything you can do as a preventative measure to boost your immune system or anything along those lines.
Sure. I think the data is, this is a novel coronavirus. I think we're all learning, we may know more later. I mean, the preventative measures we should all be doing really are 3 W's. Wear your mask, wash your hands, and watch your distance. I mean, all of the guidance sort of falls into those buckets. If you can do that consistently, I just touched my face. It's just as I said, wash your hands. Of course, I just touched my face. I think we will all be in good stead as really those are the proven preventative measures. So again, wash your grimy hands, wear your mask, watch your distance, don't get in close contact with other people. I think we can use the example, and again, the Seacoast, you guys are more than aware, there's a cluster at UNH right now from a fraternity party. At that fraternity party, there was, we believe there were folks not washing their hands, not watching their distance, and not wearing their masks. What we're finding is that in the more regulated, sort of organized bodies in businesses or in regulated communities, people are really doing the right thing.
Great. A couple more coming in. Are cell phone ping locations being used in contact tracing?
So we are not using those specifically right now. There are some companies that are using de-identified data to sort of understand travel and mobility. So sometimes you'll see on the website, like you'll see that people's travel has gone, after this first stay-at-home orders, we had this dramatic drop in the mobility of people. So that sort of data is out there. Other organizations are doing that. The Division of Public Health is not doing that right now, but we certainly use that. It's informative for us, but it's not specific to an individual's phone number. And so right now we have found that the, gumshoe detective work of our disease investigators is really been the best at being able to find folks.
Great. So there was a question that came in about what is the recommended time frame to be tested if you've suspected you've been exposed to someone with COVID?
Yeah, that's a great question. So you still have this 14-day window. You should get tested. We'll make a suggestion. So again, if you are a close contact, we're going to ask you to get tested right away. But there's still this 14-day period from your last contact with that person where you might show either symptoms or the test may come back positive.
Another question from a bed and breakfast owner. They asked if they had a positive case at their bed and breakfast, what are their legal requirements for continuing operation? Would they be required to close for 14 days?
So what I would suggest is to go back and take a look at the lodging guidance that we have right now. A bed and breakfast, again, such a small environment. If we think about typical lodging, like a hotel or a motel, that's pretty isolated. There isn't a lot of time for people to be interacting with other people. In a bed and breakfast, I understand the concern is a little bit different, but just because the space is different, and you're sharing, you're much closer, you're closer with your staff, you're closer with your other patrons. So in that case, we would suggest that you work directly with our public health nurses and our business liaison unit, and they will help you determine sort of what's the right strategy, again, given the particulars of that case. Was this a person that was just in and out, or were they in your dining area all afternoon and playing chess and playing bocce? So there are lots of particulars that can go into that.
Great. More coming in. Let's see here.
This is like rapid fire. It's like a game show.
Yeah, we don't normally get this many questions, so I'm actually.
I need like a buzzer or something, or you guys maybe need a buzzer. Like that was the wrong.
So someone asked that they basically shared that they had a young staff member call out sick, thought they might have had COVID. She immediately told her that she needed to get tested and provide the results to them. She's ultimately just diagnosed with strep. But what are they obligated to do for the rest of my staff if something like that were to happen?
So again, you did the right thing. You told her don't come to work. The employee did the right thing by saying I'm sick and I'm not coming in. I think this has been the number one thing that's been hard for all of us. I think we all have that Yankee ethic where you drag yourself to work. Like a stuffy nose never stopped you before, and certainly a cough never stopped you before. But this is the time that the cough stops you from going to work. So again, in that case, the procedure that you did was right in line with the universal guidance, and said go get tested. She had a negative test. It came back. It's fine. There's nothing that you need to do with your staff in that with your other staff in that time that someone may have symptoms. The other thing that I think that I just want to highlight everyone to, and this is one of the changes that came in the universal guidance, is this notion again of new or unexplained symptoms. We certainly, if you have any questions, default to test, default to go to your PCP or your primary care provider. But again, if you have an employee who knows that their stuffy nose is from allergies because it happens every single September and their eyes are itchy and it's completely consistent, that is they could come to work at that point. But so you really focus on those new or unexplained symptoms. We were on the task force, we had a public comment come in about someone who had a hangover, and did the person with a hangover need to not come to work? Well, I mean, that adds a lot of questions in there, but that wouldn't necessarily be new or unexplained if someone has symptoms of a hangover from being out the night before. Now, if they persist, or they're new types of, your employee went out last night and not only do they have a headache, but they're all of a sudden short of breath, that's something that's very different.
I have lots of comments about the hangover thing, but I'm going to let that slide. So there's some questions about some of the charts say 14 days, some of them say 10 days. Can you just kind of clarify? I think it's the difference between unexplained symptoms and actual symptoms, but if you can clarify on that.
Yeah, I would go back to the documents, and I don't have them up on my screen right now, but really it's about symptoms when you don't get tested. So if I am symptomatic and I don't get tested, there's really no reason not to get tested. But if you don't get tested or you're waiting, it's about the amount of time that you have to wait before you can come back to work. And that's where that 10 days comes in. But you also have to be fever-free for a certain amount of time. So I would go back. I would recommend that you go back and look to that chart in the universal guidance.
Okay, and then just a clarification, I think on the last question, I think they just wanted to be sure that should someone on your staff have COVID, you're not legally required to tell the rest or notify the rest of the staff that had close contact with them?
So the Department of Health and Human Services will provide that information to them. We'll let anyone know who was a close contact. So the employer is not responsible for telling their staff that they were a close contact person. The employer is responsible for working with public health to develop that list of who might be on that close contact list. So that is the requirement right there, is you need to work with public health. This is where I think many of you have done great jobs of really thinking about your policies about cohorting staff and really understanding who's on what shift. The more you can do that in advance so that you're not scrambling the day you get the phone call from public health, the better. But public health will contact the individuals if they are close contacts. This becomes tricky. Each business is different in terms of the level of transparency that you want to share. But again, you'll just have to keep in mind that, by New Hampshire law, as well as ADA, you can't necessarily disclose that Jane Doe has COVID-19. That's one of the things you just need to be careful about. Now, Jane may say, I had COVID-19, and she may text everybody. And we certainly know that probably happens more often than not, that someone says, watch out, I'm tested positive. But we've had a number of cases, not a number, but we've been made aware of cases where, we have employees that will tell all of their friends, yeah, I'm COVID positive, when in reality they're not.
Great, and just keep mindful of the clock here. So this will be our last question, and I think it'll be a doozy. So the question is, there are less than 300 active cases in New Hampshire out of 1.3 million people. Why should I be concerned?
That's a great question. So why should you be concerned? Because that number can grow very rapidly. And again, we have done a really good job in New Hampshire. If you look at our, I didn't send you any of the national data because I think you probably all know it. We are in a little bubble here in northern New England. Vermont and Maine doing better than us, but New Hampshire is still doing pretty darn good. It just takes that rapid transmission. There is a epidemiological term called the R-naught rate, or it's the effective reproduction rate, and that really is the chances. If you have one positive case, are they going to infect? How many more people are they going to infect? Typically, we have tried to keep that number below below 1 in New Hampshire. We are inching up over 1 now, which means I'm sick, I'm likely to make somebody else sick, and then that person's likely to make somebody else sick, and that chain just keeps moving forward. We know that there are areas of the state where you should be more concerned because rates of community transmission are continuing to grow. We know that there are types of workplaces that are more susceptible than others. We certainly saw that in long-term care earlier in the spring and early summer. And it was only through the incredible diligence of those long-term care facilities in tightening down their infection control practices and with massive amounts of testing. That was a case where, we are in there testing all the time right now so that we can, because the staff are the ones who are bringing it in, to make sure that doesn't, transmit quickly. Finally, I think the reason you should be concerned is because you don't want to give it to somebody else. You may be fine. You don't know who else in your circle. There's some estimates that over almost 50% of the adult population has some sort of comorbidity that makes COVID-19 worse. So you don't know who you're going to give that to with diabetes or hypertension or a neuromuscular issue. And so I think it is, all of us can do these very, very simple steps. Wear a mask, wash your hands, and watch your distance. Those are very simple things that we're asking you.
What a great way to end this discussion, Patricia. That the 3 W's, I'm loving that. That's a good thing for us to remember. That's fantastic. Now, I had about 8 more questions, so we don't have time for that. But I am going to ask you to give us the very specific website that you're talking about. If you wouldn't mind giving us that URL.
Sure, it's just the newhampshire.gov/COVID-19. That's the landing page. And you will see that there are places for resources up at the top, resources for business, resources for community, resources for the public. You'll see that also on the landing page there, the link to the interactive dashboards, the data dashboards. I think if we have done anything right in this pandemic in New Hampshire, I'd say it's 2 things. One, we've been really on top of contact tracing from the very beginning. And number 2 is we've tried really hard to make data accessible to people so that you can make your own informed decisions in your own communities and you understand what's going on.
Well, thank you. And I use that website a lot, to be honest, and also, and particularly for the universal guidelines, which, as we know, is a living document.
Yeah.
And I would suggest to people that you check back there really often, because it does change. And always look on the bottom of the page, it does say when it was last updated. So you want to check that all the time. I've had restaurants who have said, well, I thought we could do X, and then I went to look at the guidelines, and it used to be that we could do X, and now we cannot. So that's important. Keep that up.
And in some cases, the guidelines have gotten more permissive in some areas. So it really, I think really one of the best business policies or practices that we've seen is there needs to be, identify someone in your business who's going to stay on top of this. We call them a safety officer in the language, it's very public health, sort of OSHA language, but really name someone in your organization that's going to be checking that guidance and then is responsible for ensuring that you're following through in your own organization. In big organizations, it may be easy that's really someone's job. In smaller organizations, that just may be the business owner, but really make it somebody's job.
Thank you. That's a great takeaway for us. We really appreciate you being here, and we really appreciate all your service on the reopening task force. I know what a bear that has been. So we really appreciate all the work that you have done there. Thank you for coming and hanging out with us. We're thrilled to have you. And hopefully we'll have you back and we'll have some happier messaging at some point.
Absolutely.
So,
Always happy to come.
When we're ready to talk about vaccines, we're going to ask you to come back and chat with us about that part.
Absolutely.
Great. Thank you. So thank you all for being here today. I'm going to tell you that, remember that we've revised our schedule for Chamber Chat Live events. They were every Fridays. Now they're the 2nd and 4th Fridays of the month. The next one will be on September 25th. We try very hard to get someone, invite folks to come in who it's timely. We had to book Patricia way in advance because of her schedule, but her conversation is timely no matter where we are in this testing and COVID pandemic. So it was great that we were able to bring her in here. But who do you want to hear from on the 25th of September? Send me a text or an email. Let me know who you want to hear from, because we'll be happy to invite them to come in. And, usually I remind you to wear a mask and safe distance and wash your hands. But I think 3 W's is going to be our watchword now. 3 W's. I love that. Wear a mask, wash your face, and watch your distance. So stay with us for another moment here while we try to walk away with a smile or a happy or something along those lines at the end of every one of our chats. Today is September 11th. So today we are going to have a little video for you that is a tribute in light, and it's a commemorative public art installation first presented 6 months after 9/11, and then every year thereafter from dusk to dawn on the night of September 11th. It has become an iconic symbol that both honors those killed and celebrates the unbreakable spirit of New York, which is once again being tested, as we all know. It's assembled on the roof of the Battery parking garage south of the 9/11 memorial. The twin beams reach up to 4 miles into the sky and are comprised of 88 7,000-watt xenon light bulbs positioned into 2 48-foot squares, echoing the shape and orientation of the Twin Towers. It can be viewed from a 60-mile radius around Lower Manhattan. Be safe and well, everyone. Watch this video. Thanks so much, Ben. Everybody have a great weekend. Bye-bye.